a lot of centers, ours included, are going down to electronic health record to try to help keep that straight. But I think the truth of the matter is, we probably also need to start backing off our reliance on pharmaceutical responses to everything. But I totally agree. Managing medications, reducing medications, using only the ones that you need in the lowest dose possible are all critical variables to that person's comment about managing your medicines. And if you have a member of your family with memory impairment, where you don't have the confidence that you can actually do this for yourself, I cannot encourage you enough to get somebody to help you. I don't care if it's a neighbor, a visiting nurse, a family member, somebody you trust, whose memory is a little better than yours, who can help you set up a system and say, I just feel more confident if you could check on this. We've made this whole thing very complicated, and we've said, only a nurse can check it. Well, most of us don't have nurses coming into our houses every day to check things. And we do set up systems. So we have somebody, a healthcare professional, sometimes check once. Mothers don't have a nurse come in when they administer medicines to their children. We don't have nurses doing house visits. So, and yet we've never had, an irresponsible person taking pills on their own. So I think there are models where we can help each other a little bit more with this. There was another hand.
I just wanted to comment that CMS has come out with their new readmission, which anyone who works in a hospital knows. They've also come out with a bunch of discharge criteria. I think there's 13 of them, which is now forcing hospitals to document not only medication reconciliation, which we've been doing for a little while now, but a specific diagnosis-specific discharge plan. And then on the discharge sheet, every follow-up appointment, every lab test that is still outstanding, anything that needs to be followed up on when they leave, and they have to be called within 3 days of their discharge. So lots coming in that regard to help with making sure that people have a complete picture when they leave the hospital.
I'm glad to hear that, because I think CMS's heart's in the right place. But I also have to say that I've started working at our memory center in the University Health Center. And we just went to an electronic health record. And every visit requires a reconciliation. Everything you said, discharge from inpatient, discharge from outpatient. And my patients now, who do have any problems, are coming in with reams of paper, printed in font like this, in language that is clearly somebody pushed a button. The sentences don't make any sense. They're way too long. There's like no common sense in any of this. So our solutions to good ideas, or the way we operationalize good ideas, leaves a little to be desired. So I would ask you to look at your hospital as well. I'm trying to get our hospital to, get this to be a little bit more straightforward, because really you can't see them, you can barely read them, the font's small, and it's like, oh, now we have magic language. Press here, the person has memory problems. They get 3 pages of printouts on the medication, they're not getting anyway. Step in the right direction, but we're not there yet.
The approach of the hospitals, or at least in my experience, is that we do things because it's a regulation. And we complain about it, and we do it because it says we have to, which then provides us with paper that they can't even read. I just went to a conference in Dallas, and every time they mentioned a new regulation, they said, look at what this is going to do for our patients. And if we did things because it was the right thing for the patient, not because Medicare said we had to do it, all this would be in the right frame, and it would be useful to the patient. And I really think that, we complain and complain and complain instead of saying, it's great for the patient, let's do it right for the patient, not because someone told us we had to.
I think we have time for one more question. Is there any question that, okay?
In my situation, along this medical stuff, my mother, who was getting somewhat a little bit forgetful, goes to a couple of physicians, and not always does Dr. A know what Dr. B is doing. And in her forgetfulness, she doesn't always know why she's taking the medicine. My sister-in-law, or one of my 4 sister-in-laws, is a nurse, and is trying to find out things, but under HIPAA, who is supposed to help these people, is actually hurting us because my mother won't sign off, and we cannot get information, and my mother is not really totally, she's not totally bad, but not really in a position to get the information, so we're dealing with like a double-edged sword. And the tip of it is, in some ways, might help some people. We're like beating our head against the wall, and that we're not coming up with any answers. And our goal is to help our mother, not to stick her nose into her business.
You know, Here's another good idea gone bad. There's so many of them out there, good ideas gone bad. And, you know, as a physician, which is a job, a role I take very seriously, I used to be able to call another physician and say, you know, I'm seeing Mrs. Jones today, and she's actually not able to remember what you're treating her for. I wasn't able to get her record, can you tell me? And it used to be that somebody would say, well, I can tell you like what you need to know. I can tell you that I saw her a month ago, and yes, I increased her antihypertensives, and this is why you might care about that. Okay, we used to do that all the time. Now I get, and I never get a colleague on the phone. Now I get somebody at the office who no longer has a name like office manager or nurse, now has a name like support system specialist, who says, do you have a signed release? And I say, I can get a signed release, I can fax it over. We don't have a confidential fax machine. I said, well, you know, all I really want to know is, did you increase the blood pressure medicine? Because I'm seeing some things I want to understand. I'm sorry, Dr. Wehry, you don't understand the difference. And I say, I don't understand the loss of medicine. Okay? So I totally share your frustration. So now that I got that out of my system, let's see what you can do. One of the things that I am really sensitive to about people like your mom is that the fear of loss of self-determination is profound in seniors, particularly when they begin to experience some awareness of a loss of confidence in their own abilities. So even though your intentions are good, and even though in another time and place your mom might recognize that, her inability to trust that you're not nosing into her business is challenged by her declining memory. So here's what I recommend for families. I ask families to sit down with a loved one who's saying, I don't want your help, I don't want you calling doctors, and asking why. Well, because the doctor's going to tell you something that's going to make you want to put me in a home. Well, actually, Mom, no. All I want to know is one thing. Which one of these pills to put in this box? Okay? Could I write something up for you to take to the doctor, mail it to the doctor? You don't have to sign away all your medical information, but this, in very practical terms, is what I'm doing. Well, I don't care if you know that. That's what most people will say. Is that what you want it for? But because we get into these things, like people would give them names, and it sounds like you're signing away everything, you meet a lot more resistance. So my suggestion to you, and I think you said your sister or perhaps your wife, whomever, is that you try to find a common ground negotiation with your mom that says, I don't need to know this, I don't need to know this, but it would really help you stay in your own home, manage your own bills, do your own thing, if I could help you set up your pill box. Could we agree on that? And that's the kind of conversation. Then that letter goes to the doctor with her next visit. Mom signed off on this. I want to print out her pills. Okay? And then, if that doesn't work, there's always the threat of litigation. Nobody likes to get a letter from anybody in the family, if or not, that says, my mother had a very bad reaction to her medication. Had I been able to know what they were, I might have been able to help prevent it. I'd love to not have something like this happen in the future. Could you just tell me this much information? My mother's hesitant. If you have a better way to solve this problem, I'd love to hear it. You don't threaten like you're going to sue. You just say, gee, something bad happened, and I tried to prevent it. So I'm not saying that to, like, you know, brag on doctors, but we gotta help people get their way back to some common sense, because we're kind of in short supply on that.